Hello everyone. My name is Simiran Choudhary and I welcome you all on behalf of Voice of Healthcare to a special edition on World Environment Day series that explores how environmental sustainability and healthcare go hand in hand. In this episode, we focus on water, sanitation, and hygiene as a powerful tool for both public health and climate resilience. Joining us is Mr. Biswanath Sinha, Director, Policy and Technical Support at WaterAid India, a seasoned social development expert with decades of experience working on community-led wash solution. Welcome to our show, sir.
Thank you. Thank you very much for having me here.
Thank you so much for joining, sir. And today we'll unpack how unsafe water and poor sanitation harm vulnerable communities and why clean water is essential to climate action and what steps are needed to build resilient, equitable system for all. So without any delay, let's dive into this. So I would like to know how do environmental conditions like unsafe water, poor sanitation, or pollution impact people's health, especially in underserved communities, and why it is important to see the connection between the environment and public health.
Yeah, thank you. Thank you for this question. Let's be honest and start with a confession, and that is um, we as a country today are actually struggling a serious environmental and public health challenge. It is deeply rooted in socioeconomic inequalities, rapid urban growth, and gaps in our infrastructure. In many rural areas and urban slums, people still struggle to access basic needs like drinking water, safe toilets, and breathable air. These conditions are not just inconvenient, they are dangerous too. Contaminated water alone causes widespread illness, affecting over 1.3 crore people each year in India. And this is according to a report by the World Health Organization. Poor sanitation leads to serious health issues like intestinal infections, stunted growth in children. In fact, 35%, which is almost one in every three children in India, they are under who are under 5 are actually stunted. This is again not my finding. This is data provided by the latest National Family Health Survey, NFHS 5. So these often, reduces, increases the infections linked to unsafe sanitation, these health conditions. Now let's try to get sense about how uh, the air pollution also affects our life. So annual quality assurance report 2023 suggests that if there are 30 most polluted cities in India, in the overall world, then 21 are actually located in India. So toxic air leads to more than roughly about 16 lakhs premature deaths annually. Again, I am putting this from the Lancet, which is very popular magazine accepted all over the world. But there is a catch again. So because these environmental threats don't impact everybody in India equally, the marginalized groups, as you were mentioning in the beginning in your question, and by marginalized groups, I mean, for example, the tribals living in the states of Chhattisgarh, just to give an example, who rely on arsenic contaminated groundwater, or people who live in coastal and slum areas exposed to industrial wastes, they face more brunt of this crisis. And then India being a huge country, we have these localized challenges. States like Assam and Bihar face floods and mosquito-borne diseases, while dry states like Rajasthan struggle with less water shortages. Right now, as we are talking, the entire northeastern region is facing serious floods, whereas the entire southern northern belt where I am sitting now, here we are actually facing um, serious heat waves. So basic drinking water gets affected by both such conditions. That is why I think recognizing the connection between the environment and public health, especially through a vast lens, is very, very important.
Definitely, sir, and we do all agree to what everything, every change, and how climate has ended up in different situation of all our parts of country, and I believe that is a result of whatever global warming has caused to, or human aggressive human activities has led to. So I think that is causing a lot of issues in every part of our country. We cannot deny that, and because of that, we are facing a lot of health issues as well. Like some places have do not have water. Some places have water, but infected water, and some places is getting all those diseases because of collected water for many many times days, like you just mentioned
Yeah,
Bihar and few of the other states. So we cannot deny that fact, sir. And
yeah.
moving on to my next question, we know that water quality has been a key focus area of WaterAid in India. And so, why is clean and safe water so crucial for both health and environment? What impact do you see when water is contaminated, especially in the communities you work with?
So, clean and safe drinking water is fundamental to both human health and environmental sustainability. So, at WaterAid India, ensuring access to safe drinking water is core priority area where we work. Um, because it also affects the public health outcomes, livelihoods, and ecological balance. Now, contaminated water is a major cause of waterborne diseases. We all know that, such as diarrhea, cholera, and typhoid. Um, so, here again, the children suffer the more. So, if you see globally, the unsafe drinking water leads to approximately, you know, more than 330,000 deaths annually
Correct.
from diarrheal disease alone. And as per our experience goes in India's rural communities, these health impacts are often complicated by the lack of safe water infrastructure and the presence of chemical contaminants like arsenic and fluoride in groundwater. And both the impact of fluoride and arsenic is increasing, geographically speaking. Their spread is actually happening particularly in some river basins. So this creates complex challenge which requires urgent attention. Now, I think we must focus on the fact that Government of India has taken it seriously, and since 2019, Government of India has launched a large drinking water supply scheme, which is called National Jal Jeevan Mission. In my understanding, this is one of the largest ever, private initiatives, public initiatives taken across the globe. So we have invested so far roughly about 4 lakh crore rupees, which is roughly about 60 billion USD. And we have achieved a lot. I mean, when the program was launched, the scheme was launched in India, we had around 3 crore plus households, which is roughly about 16% of the total households in rural India, which was covered under drinking water. As we talk, as of yesterday, because the national dashboard is updated every day, so we have roughly about 15.6 crore households covered, which is about 81% of the total households across the country in rural India, I'm saying. So it is a huge achievement in terms of total number of households getting connected with safe drinking water. If our interview lasts for 20 minutes, by the time we finish this interview, 900 new families will be getting connected with household tap connection, which we call functioning household tap connection, FHTC. This is the integral part of the scheme. So to this end, I'm coming to this water quality issue. The mission also provides 10% weightage in fund allocation to the populations residing in habitations affected by chemical contaminants such as arsenic, fluoride, and nitrate. For villages facing several drinking water quality issues, states are encouraged to develop also pipe drinking water supply system based on alternative safe water sources. Now, since your question was more about also about what WaterAid does in this field,
Correct.
so we work in 11 states in India. We have our field personnel at the district levels working, staying there closely with the communities on specifically drinking quality of drinking in water quality issues. When it comes to drinking water supply systems, we work closely with the communities wherein we provide water filters. We also provide field testing kits to the communities. We train them. The communities actually go and collect water and test the water. We have software called M-Water. The findings are put up in M-Water, which it gets collected at the central location. So every year we then go for this data collection and analysis. Data collection happens twice in a year, before monsoon and after monsoon. Then we work also at the state level with closely with the state governments. Particularly some states like Madhya Pradesh and Maharashtra have taken our inputs on creating at the state level the grievance redressal system on water quality issues. We also work on evidence building from the ground because, as I was mentioning earlier, we collect data, that the data is analyzed, and we provide those findings not only to our team members but also to the government officials. At the national level, we also work very closely with the Department of Drinking Water and Sanitation, DDWS, which is the main agency implementing both sanitation and water supply systems in India under the Ministry of Jal Shakti. They have set up different committees. We were part of a committee set up about 1.5 years back on water quality as collective work of ours and DTWS and some other non-profit organizations. Towards the end of 2024, beginning of 2024, I would rather say, uh, National Handbook on Water Quality was released by the DDWS, Department of Drinking Water and Sanitation. So these are some of the engagements WaterAid India is having when it comes to you know uh, drinking water quality.
Thank you so much for answering that question, sir. And we know that how much aggressively WaterAid India is also working by its own and supporting the national initiatives, the government initiatives which the government is working on. So through this grassroots work, WaterAid India has supported many communities in improving hygiene and sanitation behaviors. So what strategies in this complete scenario or the initiatives you have taken have proven most effective in driving lasting behavior change in rural or low income areas?
So I would say there is no state cut formula. I think the basic thing is that when you are working with the communities, you have to work very closely with them. We have to understand their language. We have to understand their culture. We have to understand how to communicate with them, how to mobilize them. So very often what happens is when you actually collect information and try to do monitoring, food monitoring system, I'm not essentially talking about ourselves, but generally speaking, including the government system. So we always, tend to provide more importance on the infrastructure part and not so much on the software components. These software components are very important. Um, and it comes only when you actually work very closely with the communities. So just to give you an example, even if you say that you are working with the tribal community, for example, so tribal community itself is again diverse. So there might be, so in say in the case of Jharkhand, I just can cite, so working with Orao tribe will be different than working with Munda tribe when it comes to mm, addressing their issues as software component, which I was trying to say. So how do you reach out to the community? How much you interact with them? How much buy-in you can get from them is going to be very very critical to make this particular subject successful. The other element is as an approach uh, we try to have this village saturation approach, whereby we actually, if we go and start working in a habitation, we try to saturate the habitation so that see, for example, in sanitation, if there are say 60 households, even if one household goes out for open defecation, then the that pollutes the entire community. It doesn't pollute only one family. So I think this village saturation mode is very important for us. And and then I think the third element, which is very important for us, is not only to work with the communities, but also work within the institutions. So by institutions at the village level, I mean the schools. It may be primary school, it may be higher secondary school, high school, middle high school, and the healthcare facilities. Again, it may be primary healthcare centers, it may be sub centers depending on where you work, and the Anganwadi centers. So I think providing complete was infrastructure facility in all these institutions is extremely important.
Definitely, sir. When we provide all the resources, the complete infrastructure to the organization or to the poor people who are working to this direction, I think they get that support, that back end support. Now they can go ahead with the plan they have, and I believe that will be. Then they get this as a surety that things will change, things will be better, as and they will fight. They are for the cause they are fighting for will be resolved. And thank you so much for sharing that expertise, that opinion
Mhm.
with us, sir. As we are coming close to end of our discussion, as someone working closely with the communities on WASH like you and the environmental issues, what message would you like to give to the on this World Environment Day, especially to the citizens, health workers, and young change makers about their role, both human and as for the both human and planetary health? Because we know water, sanitation, and hygiene is very important, very basic, and how it impacts overall for the planet, for the human health, and for the basic needs as well.
Yes, so I think experts would give. I'm not the most eligible person to give expert view on how to go ahead on this, but I would say that let's make things simpler for the citizens, and to actually make it successful. This whole addressing all these issues regarding um, the betterment of the environment. I think we have to simplify things, particularly when we reach out to the public. And for me, the mantra lies on three things. One is uh, utilizing our health workers as environmental stewards. So I know that the frontline health workers are overburdened already with lots of tasks, but the frontline itself can be strengthened further. There is no harm in increasing the human resources available at the grassroots level. I think this is going to be extremely, extremely important. If the environmental issues are becoming so critical for us, um, today actually we don't know what will happen in another 30, 40 years when it comes to climate change and climate change related impacts on our life. So thereby promoting hygiene, waste management, uh, and disease prevention, if we actually address all these issues at the grassroots level, then I think the human resources have to be strengthened further there. My second mantra would be involve the youth and let the youth, lead the way. Uh, I think we have about 65% of our population which is below the age of 35. So if the youths are given more, empowerment, more education about this issue, they can actually bring lots of, you know, um, energy, and I think I believe they are better equipped to address the equity issue. I think, as I mentioned earlier, uh, as a big country, as a diverse country, one solution will not fit everywhere for India. So thereby, this addressing the equity issue is also going to be very, very important. And I think the third important point is, you know, invest on innovation and new technologies. So just to give an example, we produce something like, I think, uh, 12 billion tons of um, sanitary wastes every year. And there is hardly any scientific way, largely adoptable solution or tech solutions available today in India. So I think technology and innovation can bring lots of changes in a very, very, I mean, small timeline. So it can bring um, positive changes speedily, quickly enough, because I think the climate and environmental emergency today is very, very critical. It has to be addressed. It cannot wait for tomorrow. It has to be addressed on urgent basis.
Very rightly said, sir. It needs to be acted on urgent basis, and it is the time now to act. And you pointed out very relatable and points which are actually action needs to be taken on them. That is, one, we need a good equipments, good innovation, good technology, so that we can manage all these kind of waste.
Yeah.
We need to educate, aware our youth, and because they will be the future, and whatever we are witnessing right now is nothing as compared to if we continue what is happening right now, then I think we will see much worse than this. And I think it's the right time to take action, and to move on, to be conscious of our environment on this World Environment Day. Thank you so much, sir, for sharing your expertise, opinion with us on such important topic, that is water sanitation and hygiene, and how it is affecting global health, right? And especially for the underserved communities.
Yeah.
Uh, our aim is to create awareness on this, and you have helped us a lot on this, sir. Thank you so much for coming to our platform, sharing your views, and educating our audience with us. Thank you so much.
Thank you so much. It was my pleasure. Thank you.
Thank you so much.